Okay, so we have is posterior fossa malformation. This is going to be the topic in this lecture. So I have created a diagram here in order to understand what are the portions we are going to cover in the posterior fossa in this sagittal view. So you can see in this view, this is the posterior fossa, and these are the parts or areas you're gonna cover. Here we have the midbrain, here we have the pons, and there we have the medulla. Here we have this foreventricle, and the cerebrum is here, and the tentorium is here. So this is a posterior fossa. Here we're going to have malformations here. Here we're going to have obstructions or whatever disorders. Everything we're gonna see in this area. So now we have is Chiari I malformation. So in I malformation, what we see is that there is a downward. Okay, so as you can see in this diagram, you can compare the parts and you can mark in your brain that these are the parts we're talking about. So here we have a cerebrum. This is a cerebrum here. So what they're saying is that there is a downward displacement of cerebral tonsils. So here we have the cerebral tonsil, and as you can see there is a downward shift in the tonsil and through the foramen magnum. So here we have the foramen magnum. Foramen magnum is a opening through the occipital bone. It's a wide opening, it's an oval shaped opening here where all these structures passes by. Also, there's one more thing to see here is that there is just one structure displacement happening here. Only this cerebral tonsils displacement is happening. Whereas in other one, we can see the displacement of two structures, which is cerebrum and medulla. Well, we are going to comment on it later. First, let's see the other line. Usually, asymptomatic in childhood. So we're not going to see any symptoms in the childhood, but as the childhood begins, as the person started to grow in the adulthood, they're going to get headaches and they're going to have cerebral symptoms. So what are going to be the cerebral symptoms here? So the symptoms which are going to be here is dysmetria and ataxia, nystagmus, intention tremors, speech. They're going to be speech problem like they're going to be scanning. Hypotonia is going to be there. Okay, so I have mentioned, I have written the examples of the symptoms, but then I don't know if you're going to see them because I'm just to saving the time, I'm writing it before. But the symptoms gonna include dysmetria, and dysmetria is something where we cannot cannot calculate or cannot control the distance and the speed which is necessary to perform any coordination. Whereas ataxia is going to be coordination issues, or which is going to be through the damage to brain or nerves and muscles. Nystagmus is going to be the eye movement coordination issue, where the eyes are going to rapidly move from side to side, kind of a thing, like up or down in circular motion, like that, and which is going to be profound with the blood region also. Then intentional tremors are going to happen whenever the patient is going to have an intention of doing something. The body will shake, or the body parts are going to shake. Hypoxia is not hypoxia, hypotonia is what we are going to see in cerebral symptoms, where they're going to be a decreased muscle mass in the patients. Okay, so this is going to be associated with the spinal cord cavity. As you can see, here we have the cavities. Here we have the lateral ventricle. We can see the lateral ventricle clearly here. And then we have the third ventricle. Then we have the third ventricle here. We have the aqueduct here. We have the fourth ventricle here. So these are the cavities that I'm talking about. So it's all associated with the cavities like Syringomyelia. As we have previously studied it, Syringomyelia is a neurological disorder where there is a fluid. Here we can see the fluid, the CESF is going when it's going to be too much. So they're going to be overfilled cyst. We're going to see here, and that cyst is often called syrinx. So that's what it's going to form in the spinal cord. So that is what the condition is related to it. Now let's see the other one. Chairi second malformation, Chairi II malformation. So there going to be a downward displacement of cerebrum, which includes vermis and tonsils. So here we can see in the other picture here. Here we have the cerebrum, okay, and here we have there's the tonsils and the vermis is going to be here. Cerebral vermis is going to be in between the midline. So midline vermis and the tonsils are going to get displaced, and then it has medulla also. So the two of them, let me just mark it, let me highlight it. So in Chiari I, we can see that there's a displacement of tonsils, cerebral tonsils. Okay, this is the one structure, and here in Chiari 2 we have the displacement of cerebrum, which includes vermis and tonsils, and the medulla. So one more thing we can see here is that in the cerebrum displacement in the Chiari 1, we only had the tonsils displacement, but here in cerebrum we have the vermis and the tonsils both getting displayed and then displaced, and then we have the medulla. So that's how it's going to make two structures. Now it's going to pass through the foramen magnum. Foramen magnum is going to be here. As I told you, it's the opening, it's a large opening inside the occipital bone. So that's where, same as the Chiari one, it's going to pass through the foramen magnum. Now, they're going to be non-communicating hydrocephalus. In this kind of condition, what happens is that there be obstruction in the flow of cerebrospinal fluid, CSF. So here we have the ventricles. Here we have all the ventricles, and there be a obstruction or a blockage through whatsoever thing. It could be a tumor thing or any thing which is obstructing it to pass, which eventually is going to create intracranial pressure here, which is going to turn out into the enlargement of the ventricle system, ventricles. That's what. And there's this thing that it is more severe than Chiari 1. Of course, you can see there are more destructions, and it is usually present daily in early in life with dysphagia. So dysphagia is a condition where you feel difficulty in passing through the fruits and food through your pipe, and then we have stridor where there be a blockage in your nasal area, and you have to be taking the breaths through your mouth. So you'll be breathing through your mouth, and then we have, so they're going to be apnea. So it's a condition where you feel difficulty breathing while sleeping. or there be obstruction while breathing in the night. Then we will see the limb weakness, and it's associated with the myelomeningeal, which we have studied previously, which is usually going to be in lumbosacral region, where the spinal cord canal couldn't be closed. It was a type of neural tubal defect. Now we have another malformation, that is Dandy Walker malformation. Here, what we're going to see is we're going to see a genesis of cerebral vermis, which basically mean that they're going to be a absence, or they're going to be undeveloped um, portion of cerebral vermis. It is going to turn into a cystic enlargement of fourth ventricle. Here we can see the fourth ventricle is enlarged, and you can see the arrow B here. And that was the enlargement, that was the enlarged posterior fossa. So we saw the posterior fossa area, and it's all swelled up. As you can see, everything is enlarged here. So this is what's going to happen here, and it's going to be associated with non-communicating hydrocephalus. Again, as we saw here, it was Chairi II where we saw non-communicating hydrocephalus. Again, we have the same condition, and it's also going to be associated with the spino bifida, which also we previously studied that they're going to be improper development of a spinal cord. So this is what we have seen so far in posterior fossa malformation. Now let's move to the another slide. So Syringomyelia is our heading now for now, and here let's just know what is Syringo means first. Mylia is the spinal cord they're donating it to. So Syringo, we have seen before the syrinx. So syrinx is derived from the Greek word, and which actually means a tube-like structure, as in the syringe we have seen. So it's fluid filled. It's fluid filled syringe. You can see these tube-like structures here. So it's fluid filled and giliosis lined cavity. So giliosis is referring to the um, abnormal proliferation of glial cells, such as astrocytes, which happens to be there when there's some scar formation happening due to some injury or anything. So those glial cells basically lined up the cavity and within the spinal cord, and as they're showing it through the arrows also, you can see here. So now they're saying the fibers crossing here in the anterior white commissure. So which is also passing through that spinothalamic tract. And this part, anterior white commissure, is the first thing to get damaged first if any kind of a thing happens. It shows like a cap like a thing. So if something like that happens, if this get damages, so what happened is that the pain and temperature sensation in the bilateral upper extremities loss. So they feel a loss of pain and temperature in this upper limbs portion. Here you can see the upper limbs, and this which these bilateral upper portion also includes the shoulder and elbows and hands and all of that. And as the lysine expands, it may damage anterior horns also. So we have these anterior horns. If it's going to expand whether downwards, so it's going to damage this anterior horns also, which is going to result in the lower motor defects, lower motor neuron defect. So this is what they're saying, going to defect in the lower motor neurons. So this is what happened in it. So here also in this diagram, they are saying the same thing, the loss of temperature and sensation in the affected upper limbs. And yeah, we haven't seen this portion. So most lesions occur between T2 and T9 vertebra. So this is going to start from C2 and it's going to and in the T9. T9 here, C2 and T9 here. So and it's usually associated with Chiari I malformation, which we saw in the previous slide also, that they mentioned in the Chiari I malformation. The example they had was Syringomyelia. So the same thing it is here, and it is also they are donating it with the red arrow here. It's coming downward. The cerebellum is coming downward, and it's getting displaced from its position. So that is what there was there in the Chiari malformation, and less commonly associated with other malformations. So it is normally associated with the Chiari I malformation only, and less commonly with the other ones like infection, tumor, or trauma, anything like that. So this is it